म्हाका आजचे घेता आसतना पांय म्हाका बांदपाक पडटाले, टॅग बांदपाक पडटाले, हेच करून तीर घेवन कुठे बांदपाक पडटाले, एक सकयल जंप पडपाक. तरी आसून म्हाका एक 1 hour 2 hour जंप पडटा, मागीर परतून ते टायट जावन ते दुखपाक लागता, ते सोडून परतून जावपाक लागताले. हांव पयलो शिवपाचेर प्रेस्टिजर मारलो आनी केन्ना हांव जॉयन जालो 2000 तेन्ना मातशें हांव बरो आहलो. मागीर कितें जावपाक लागलें, इयर्स जाता तितलें आमगेले पांय सोडपाक लागलो. मागीर डे बाय डे सारकें चड जावपाक लागलें, सारकें चड जावपाक लागलें. मागीर डॉक्टरांक वचूंक पडलें म्हाका, तेका आनी हांव डॉक्टरांक वयलो.
So this 50-year-old gentleman, he came to my OPD 1.5 months back. So he walked into my OPD with a limping pain in the knee joint. He was not able to walk. He had a big swelling in his knee joint, and he's been having this pain for many months. I mean, he was working in the ship. He used to come to India, met multiple doctors, went to multiple hospitals. He took multiple opinions, and he went to multiple centers, and without of much success, and finally he met me in the OPD. I examined him completely, and after proper evaluation we found out that he had a tumor in his the bone in the leg, which was a very destructive type of tumor, which I destroyed his bone and his cartilage, also the joint space, and also it was putting pressure on the important vital structures like the nerves and the blood vessels which supplies the leg.
कॅन्सर म्हणल्यार म्हाका भिरांत दिसपाक लागलें, कित्याक काम करपाक जातालें मागीर प्लस मनी, तें दोनूय चड म्हाका भिरांत म्हाका जेवप पडना.
So after carefully evaluating, we formed a team, myself, the orthopedic surgeon, and also a plastic surgeon. We devised a treatment plan, and we performed a very complicated surgery, one of its kind, wherein we wanted to save his leg. He's a 50-year-old gentleman. Chopping off the leg is very easy, but saving his leg and giving him a new lease of life is a different thing.
We removed his tumor, and we made sure that the entire bone length is maintained again by using a mega prosthesis. The tumor was somewhere around the knee region. It was initially planned that we will take a cut on the skin as per the biopsy mark, and we did that. However, when we went ahead, we had to remove a lot of tissue around the bone, including a 15 centimeter of bone altogether. Now, when you have such a large, big deficit of bone, it becomes very important to how will you cover this part. We had discussed this earlier, and we prepared for this in advance. What we did was we ordered a mega prosthesis. This was a modular mega prosthesis. So when we had taken the cut, making sure all the tumor margins are removed and the bone is now safe, there is safe margin. We also resected a lot of chunk of soft tissues, and then we introduced this mega prosthesis. We put a cemented prosthesis within the bone. Some prosthesis was put in the tibia, and the knee surface was again realigned. Intra-op, we made sure that we checked for all the movements of the knee, and it was an amazing moment to understand that the range of motion was completely fine. He had almost 120 to 130 degrees of flexion on the OT table. The next challenge now was to prepare all the soft tissues and to cover this entire prosthesis with muscle covering.
Once this was done, the reconstructive part came in picture. That is, we had to cover a large defect, the length was around 30 centimeters, the width was around 20 centimeters. So we took a muscle called as latissimus dorsi, which is from the back, that is the left side of upper back. So we took the muscle along with the blood vessels and a part of skin. Now these blood vessels are of the diameter of around 1.5 to 2 millimeter, an artery and a vein precisely. So this muscle was completely separated from the back and attached to the vessels in the leg. Once the flap was put, we noticed that there is good amount of blood flow from the leg into this muscle, and after that we took a skin from the thigh and put it over the muscle that was put.
Now, आता म्हाका 1.5 months जाले. आता 1.5 months म्हणजे पांय गेलो वल्ली घाता म्हाका जमनीर तिकोवपाक जाता. तेका हांव ट्राय करता मातशें तिकोवपाक हें करून तेका लिफ्टिंग करपाक जाता मातशें तशें.
Post-op, the patient is doing very fine. He walks, he can put weight on his limb, and it's always a very happy sight to see your patient walking. A person who had such a large tumor has been completely resected, and now it's good to see him pain-free and without a tumor.
Thank you for the victorious part. ऑल द सपोर्ट म्हाका ताणें दिला स्पेशली फॉर द डॉक्टर अविनाश, डॉक्टर विकास, डॉक्टर सुरेश. म्हाका जाय ते हेल्प केलो म्हणून आयज हांव म्हणजे मातशें चलपा जाता, म्हणजे भोंवपा जाता. नाजाल्यार म्हाका खबर आसा, नाजाल्यार हांव आयज बसून हांव कंप्लिटली लॉस केस आसतालो. हिंगा थिंगा धांवपाक उरता जाल्यार हॉस्पिटल डॉक्टरान कडेन. ताका लागून वन्स अगेन थँक्यू.